Hi, everyone. We're Mimicker, here to introduce all kinds of knowledge, even the stuff we didn't know about. So, welcome to a brand new deep dive for I Know You Don't Know.
Glad to be here.
Imagine you're just like walking through a busy downtown area. People are shopping, grabbing coffee. But then on the corner, you see someone standing completely rigid.
Oh, yeah. Like their body is locked in these violent, involuntary muscle spasms.
Exactly. Just unable to control their own limbs, looking like a literal zombie. And your first thought is probably that they're having a medical emergency.
Right, but then you notice what's in their hand.
Yeah, it's not a syringe or anything. It's just an everyday fruit-flavored e-cigarette. So today we are mapping out this critical 30-year evolution of Taiwan's drug crisis.
It's a really important timeline to understand.
It really is, because the data we collect reveals this terrifying shift toward what people are calling zombie vape cartridges, which are powered by this chemical called etomidate.
Yeah, and the visual you just painted, it's becoming an increasingly common reality out there.
Which is just crazy to think about.
It is. We are looking at a complete systemic shift in how illicit syndicates operate today. Like they've totally abandoned those traditional heavily guarded jungle compounds from the past.
Right, those feel like something out of an old movie now.
Exactly. Today's operations have modernized entirely. They turn mundane residential apartments into microchemical labs, and they deploy the exact same sleek, consumer-friendly marketing tactics you'd expect from, like a Silicon Valley tech company.
Wow. So our mission for this deep dive is really breaking down the mechanics of how this crisis evolved to this precise moment, right?
Yep. The biological havoc these vapes wreak on the human body, the regulatory loopholes keeping the cops a step behind, and importantly, the safety nets designed to pull people out of this trap.
Okay, so to make sense of these zombie vapes just flooding the market, we really need to look at the historical arms race that got us here.
Right, because the drug market in Taiwan didn't just wake up one day and decide to manufacture vapes.
No, it was forced into this corner over, what, 3 decades?
Yeah, it was an evolution totally driven by necessity and government intervention. So in the first major wave, from the 1990s into the early 2000s, heroin was the predominant threat.
And heroin is usually injected, right?
Exactly. Because it was primarily administered intravenously, it created this massive secondary crisis. Basically, an exponential spike in HIV infections.
Oh, wow. Because of the shared needles.
Yeah. The underground networks were sharing needles, and it transformed an addiction problem into this runaway viral outbreak. Just a catastrophic public health emergency.
I mean, a runaway viral outbreak demands a very different response than just, arresting dealers. You have to stop the transmission vector itself.
That's exactly what the government realized. Punitive measures just weren't stopping the virus. So back in 2005, they implemented this massive harm reduction program.
Okay, how did that work?
It was a highly pragmatic public health strategy. They introduced oral methadone as a substitute for the needles.
Ah, so they swapped the delivery method.
Right. By giving users a safe, clinically managed oral alternative, they completely broke the chain of blood-borne transmission. It successfully neutralized the HIV spike and severely undercut the circulation of heroin.
But I'm guessing the black market just pivoted. I mean, if needles are too risky and heroin is suppressed, the syndicates need a new product line.
They did. That pivot totally defined the 2010s. It became the era of synthetic drugs, primarily methamphetamine and ketamine.
Right, the party drugs.
Yeah, the demographics shifted from hidden underground alleys to, vibrant entertainment venues and younger crowds. But even then, you still had obvious paraphernalia.
Like powders and crystals and specialized pipes, yeah.
Exactly. Which brings us to the 2020s and the current era of new psychoactive substances, or NPS. The whole strategy now is total camouflage.
Wow.
Yeah, the substances are engineered to be hidden in plain sight. They're baked into cookies, infused into candy, and most notably suspended in the liquid of trendy e-cigarette cartridges.
It's basically the ultimate lowering of the psychological barrier to entry. Like, I look at this almost like the evolution of the tech industry. Illegal drugs went from being this clunky, highly dangerous, socially stigmatized hardware like shared needles to these sleek, consumer-friendly wearables.
That's a really good way to put it.
Right, because if a teenager is handed a fruit-flavored vape at a party, the traditional alarm bells that would go off if they were handed a bag of white powder, they just stay completely silent. I mean, doesn't the sheer convenience make it exponentially more dangerous?
Oh, absolutely. The disguise strips away the inherent fear of consumption. When the delivery mechanism is normalized in youth culture, the perceived risk drops to practically zero.
But the actual risk is huge.
Yeah, there is a massive, incredibly dangerous disconnect
Yeah.
between how harmless the vape looks and the devastating biological payload it actually delivers.
Okay, let's break down that biological payload. Because vaping is so normalized, a user might just assume the effects are mild, like a slight buzz or maybe a head rush.
But the chemical reality of etomidate is incredibly erratic.
So what exactly is etomidate doing in the body?
Well, etomidate is classified as an ultra-short-acting central nervous system anesthetic. On a neurological level, it specifically targets and binds to GABA receptors in the brain.
Okay, let me stop you there because understanding GABA is crucial for you guys listening. Think of the GABA system as your brain's primary brake pedal.
Right.
It's the inhibitory system that tells your neurons to calm down, stop firing so fast, and just relax. But if a drug is hitting the brake pedal, shouldn't it just make the user sleepy or lethargic? Why are we seeing people twitching violently and losing total motor control?
It basically comes down to systemic overload. Like when you use the brake pedal normally, the car slows down. But if you slam a massive unregulated brick onto that brake pedal, the entire electrical system of the car glitches.
Oh, wow.
Yeah, so in the human body, this unregulated dose completely overwhelms the central nervous system. It triggers a severe neurological short circuit known as myoclonus.
And that's the zombie effect.
Exactly. Myoclonus presents as involuntary, violent muscle spasms. The user's brain can no longer coordinate with their muscles. They lose the ability to stand, walk, or even, control their own face.
But wait, if etomidate is an anesthetic, it has a legitimate medical use, right?
It does.
Like it's used by anesthesiologists in hospitals to put people under before surgery. If it's safe enough for a hospital, how does it turn into a lethal street drug?
Well, the line between a medicine and a poison is always the dose and the environment. In a clinical setting, an anesthesiologist is administering a micro-calculated dose. It's tailored to your exact body weight, strictly to induce sleep before intubating you.
And you're being monitored the whole time.
Right. During that entire process, you are hooked up to machines monitoring your heart rate, oxygen saturation, blood pressure, minute by minute. On the street, there is no anesthesiologist.
Right, it's just some guy mixing it in an apartment.
Exactly. A syndicate mixes an unknown massive quantity of raw etomidate powder into a vial of vape juice. A teenager takes a huge drag, maybe takes 5 more, and often mixes it with alcohol or other depressants.
It's just reckless, blind chemistry. And the data we collect highlights an even darker hidden mechanism behind the twitching.
Yeah, the endocrine system.
Right, it's not just scrambling the brain's electrical signals. It's quietly destroying the endocrine system through something called adrenal toxicity.
This is the mechanism that makes etomidate truly lethal. The drug actively suppresses the adrenal gland's ability to synthesize cortisol.
And cortisol is the stress hormone, right?
It is, but it is fundamentally necessary for survival. It regulates your blood sugar, manages inflammation, and critically, it maintains your blood pressure.
Oh, I see where this is going.
Yeah. When etomidate shuts down cortisol production, the user is pushed into a fatal adrenal crisis.
Because if your body suddenly can't maintain blood pressure, everything just crashes.
Exactly. The blood pressure drops so rapidly and severely that the person goes into physiological shock. Their organs stop receiving enough blood, which leads to multi-organ failure.
That is terrifying.
It really is. And furthermore, because the entire endocrine system is thrown into chaos, we see profound hormonal disruptions. Like, clinical observations show women presenting with severe hair loss, sudden abnormal facial hair growth, and completely disrupted menstrual cycles.
Wow, the hormonal crash is just aggressive.
It's incredibly aggressive.
And the mortality rates completely back up how aggressive it is. Looking at the medical literature, 9% of emergency room cases involving etomidate require immediate admission to the intensive care unit.
Yep.
And 7% of those ER cases result in death. I mean, that is a staggering mortality rate for something being passed around at a high school party.
It is a profound public health threat that's basically masked as a recreational habit.
Which brings up a glaring question. If this substance is putting people in the ICU and causing violent public seizures, how is it spreading so fast?
That's the big issue.
Right. Why isn't law enforcement intercepting it before it reaches the consumer? And from what we found, the answer lies in a combination of a highly decentralized business model and this bizarre biological loophole.
Yeah, so first, the economics are intentionally calibrated for rapid youth adoption. A single etomidate cartridge is priced between 800 and 1200 NTD.
Which is pretty cheap.
Very affordable. It easily fits within the disposable income of a student. And with an estimated 54,000 teenagers already accustomed to using e-cigarettes in Taiwan, the consumer base is completely primed.
So they don't even need to sell the habit of vaping.
Right, they just need to sell a new cartridge.
And the production of those cartridges doesn't look like anything out of a movie, right? There's no heavily guarded warehouse.
Not at all. The supply chain is fractured and basically invisible. Smugglers bring in the raw, highly concentrated chemical powder from regions like Southeast Asia.
Okay.
Once the powder's in the country, the whole operation just disperses. Anyone can go online and legally purchase empty vape cartridges, flavoring, and liquid bases.
So an individual can turn the kitchen counter of their studio apartment into a microlab.
Exactly. Just mixing the juice and filling the pods themselves.
No physical storefronts, no shady street corners. The transactions happen entirely on encrypted messaging platforms like Telegram or Instagram.
Yep, it's all digital.
The dealer takes the payment digitally, leaves the package at a dead drop location like behind a specific mailbox, and the buyer just picks it up. They never even see each other.
It's a ghost network.
But the digital encryption isn't even the most frustrating part for law enforcement, is it? The drug itself possesses a kind of biological encryption.
Yeah, this is the most significant tactical hurdle police are facing right now. Etomidate has an incredibly short biological half-life of only 2 to 3 hours.
Wow, that's fast.
It is. That means the concentration of the drug in the human body drops by 50% every 2 to 3 hours.
Okay, let's put some numbers to that so you listening can really see the loophole here. The legal threshold for a positive drug test in Taiwan is 50 nanograms per milliliter in urine.
Right. So take a documented case from the field a user is brought into the station, and their initial preliminary test shows a concentration of 96 nanograms per milliliter.
Okay, so clearly intoxicated, visibly impaired, and almost double the legal limit.
Exactly. But the suspect knows the biology, so they refuse to provide a formal sample immediately. They argue, they stall, they ask for a lawyer, basically dragging the process out for 6 hours.
And 6 hours equates to 2 or 3 half-lives.
Yep. By the time the police finally secure the official sample, the concentration in the suspect's body has metabolized and dropped to around 40 nanograms per milliliter.
Which falls below the 50 nanogram threshold.
You got it.
So they are legally negative. That is wild. It is essentially Snapchat for toxicology.
That's a great analogy.
The biological evidence literally deletes itself from the user's bloodstream before the bureaucratic gears of the justice system can process it.
It's incredibly frustrating for the police.
But hold on, if the standard immune system screening tools are this vulnerable to time delays, why aren't the police utilizing more advanced instant testing technology?
Well, the limitation isn't the technology, honestly. It's the rigid legal framework. The current legal protocol demands a two-step verification process.
Okay, what does that involve?
Step 1 requires an immunoassay screening test. That's a basic, commercially produced chemical reaction kit. Only if that is positive can the sample move to Step 2, which is using the advanced machinery.
But because these new psychoactive substances alter their chemical structures so rapidly, the commercial medical companies haven't even had time to invent, manufacture, and distribute the Step 1 tests for them.
Exactly. Therefore, the process just stalls at Step 1. You can't use a test that doesn't exist yet.
Right.
So the most urgent recommendation from researchers is that the legal system must abandon this outdated two-step mandate. They need to allow law enforcement to bypass the commercial kits entirely.
And go straight to the big machines.
Right. They need immediate access to advanced mass spectrometry, specifically a technology called LC-MS-MS.
Okay, let's explain what that is, because it sounds like pure science fiction. Liquid chromatography with tandem mass spectrometry.
Quite a mouthful.
It is. So think of a drug molecule like a massive, complex Lego castle. The LC-MS machine essentially smashes that Lego castle into individual pieces and then precisely weighs every single solitary brick.
That's exactly how it works.
Because every chemical breaks apart in a highly specific, unique way, the machine gives you an undeniable, instantaneous chemical fingerprint. It doesn't need a commercial test kit. It just reads the raw physics of the drug.
It is absolutely the gold standard of chemical identification. But it requires systemic legal approval to become the frontline tool.
So the street-level cops are fighting a ticking biological clock. What about intercepting the ingredients before they ever get mixed in those apartment microlabs?
That's a whole other issue.
Yeah, we have to look at the massive administrative blind spots regulating precursor chemicals in Taiwan.
Right. So the regulation system divides these ingredients into two categories. Class A precursors are the primary building blocks. They're the chemicals that physically form the core structure of the illicit drug.
And Class B?
Class B precursors are the secondary materials, like specialized solvents or acids required for the chemical reactions.
Now, that categorization sounds organized, but the execution is deeply flawed, isn't it?
Deeply. The communication between agencies is shockingly fragmented. For instance, police conducted a raid and seized 425 kilograms of chemical precursors.
Wow.
However, because the drums lacked official commercial labels, the police did not notify the Ministry of Economic Affairs, which is the very agency responsible for monitoring chemical manufacturing.
Wait, that is almost half a ton of raw drug manufacturing material seized, and the department regulating the factories isn't even alerted to investigate where it leaked from?
Nope. The tracking chain just evaporates.
That's insane.
And the oversight is already stretched incredibly thin. The Ministry of Economic Affairs only possesses the resources to conduct random physical inspections on approximately 14 to 15% of registered chemical factories annually.
So that's an 85% blind spot?
Yeah, which is more than enough room for illegal diversion to thrive.
And the situation deteriorates even further when the cartels introduce a brand new ingredient. Let's talk about MMMP.
Good example.
This is a newly identified precursor chemical critical to manufacturing these modern synthetics. Now, if you listening right now assume the government just immediately bans it, you are going to be incredibly frustrated. How long does it actually take to get a chemical like MMMP off the legal market?
Well, the administrative bureaucracy is paralyzing.
Hmm.
When a new precursor like MMMP is discovered, it must undergo a comprehensive evaluation by the environmental agency to be officially designated as a chemical of concern.
Okay.
That specific administrative process currently takes over 16 months.
16 months. A year and a half. These cartels operate on digital speed, communicating on encrypted apps and altering molecules in days, and the government requires 16 months of paperwork to declare an ingredient illegal.
It's a huge window.
During that massive window, cartels can legally import multi-ton shipments of MMMP right through customs. Other nations cannot possibly be operating with this kind of lag.
They aren't. And Taiwan has several global models it could adopt immediately. For example, in 2016, the United Kingdom enacted the Psychoactive Substances Act.
How did that work?
It basically took a scorched earth approach. It instituted a blanket ban on the production and sale of virtually any substance that alters a person's mental state.
Just a total ban on everything.
Pretty much, offering specific exemptions only for normalized items like alcohol, caffeine, nicotine, and legitimate medicines.
I mean, that certainly closes the loophole, but it's a massive sweeping law. Is there a more surgical approach?
Yes. Germany utilizes what is known as the generic approach. Instead of banning a single specific chemical name like etomidate Germany, bans the core molecular structure of the entire chemical family.
Ah, okay. Think about it like the automotive industry, right? Taiwan's current system is like banning a specific red Honda Civic. The cartel just paints the car blue, changes the name to a Honda Accord, and suddenly it's completely legal to drive for another 16 months.
Exactly.
But Germany's approach bans the fundamental concept of a four-wheeled combustion engine vehicle. It doesn't matter what color you paint it, the core chassis is the legal.
That structural ban is precisely what researchers are urging Taiwan to adopt. Under the current whack-a-mole system, if a cartel slightly tweaks the etomidate molecule to create a variant, say, Propoxate Taiwan's committee has to start a new 16-month review.
Right.
But if Taiwan adopted Germany's model, Propoxate would be illegal the absolute second it was synthesized in a lab, because its core molecular family is already outlawed. The 16-month administrative lag is instantly eliminated.
The structural approach just makes undeniable logical sense.
It really does.
Well, we've covered the bureaucratic failures, the terrifying biological reality of the cortisol crash, and the encrypted supply chains. But we have to talk about the human element here.
Absolutely.
For the 54,000 teenagers vaping, or anyone who has already unknowingly inhaled etomidate and finds themselves physically addicted, what happens next?
It's a critical question.
The system seems incredibly punitive, but the data actually details a very specific subsidized pathway out.
Yes, and it is critical for the public to understand that the legal framework contains a dedicated off-ramp. Under Article 21 of the Narcotics Hazard Prevention Act, Taiwan offers a voluntary rehab amnesty path.
Okay, how does that work?
If an individual recognizes their addiction and voluntarily steps forward to seek medical assistance at a designated hospital before they are investigated or caught by the police, the hospital operates under strict medical confidentiality.
Oh, wow.
Yeah, they are legally bound not to report the individual to law enforcement. The user faces zero criminal charges.
That is a phenomenal safeguard. If you walk into a hospital asking for help before you are arrested, you are treated entirely as a patient. Your criminal record remains spotless.
Exactly.
But what if the police get to them first? What if a teenager is caught with a zombie vape in a park?
The door to recovery hasn't completely closed even then. During the initial investigation phase, the individual has a critical window to request what the legal system calls deferred prosecution for the purpose of addiction treatment.
How does deferred prosecution actually function in practice?
The individual must undergo a comprehensive medical and psychological assessment, which costs around 4,000 NTD. If the medical professionals determine they are a viable candidate, the criminal charges are officially paused.
Okay.
The individual is then mandated to complete a rigorous 6 to 12-month rehabilitation program. This is not a simple slap on the wrist. It entails intense psychological counseling, cognitive behavioral therapy, and medical intervention to manage the severe withdrawal symptoms of substances like etomidate.
But the leniency comes with extreme conditions, right? You can't just casually attend a few sessions and walk away free.
No, the compliance requirements are absolute. If the individual misses 3 scheduled therapy sessions without a verified, valid medical excuse, or if they fail a single random drug screening during that entire year-long period, the deferred prosecution is instantly revoked.
Ouch.
Yeah, the pause on their criminal charges is lifted, they were sent straight back to trial, and they face genuine prison time.
The accountability is really high, but so is the cost. I mean, comprehensive medical and psychological care for up to a year is incredibly expensive. We're talking upwards of 40,000 NTD. For a teenager or a family already struggling, that price tag alone could keep someone trapped in the addiction cycle.
Recognizing that financial barrier, the government has implemented substantial subsidies. The goal is to ensure that the cost of treatment is never the reason someone remains addicted.
That makes sense.
Yeah, the state provides up to 35,000 NTD per year for adults and up to 40,000 NTD for minors to entirely cover these therapeutic assessments and treatments.
So they're essentially footing the entire bill for the youth demographic.
Pretty much.
And if you think about it from a macro perspective, 40,000 NTD for a year of rehab is incredibly cheap compared to the societal cost of ignoring the problem.
Without a doubt.
A single week in an intensive care unit for an etomidate-induced adrenal crisis, plus the subsequent burden on the criminal justice system, costs taxpayers exponentially more. By heavily subsidizing rehab, the system is making a calculated, compassionate decision to treat the addicted user as a patient who needs rescuing, rather than a criminal who needs warehousing.
That is the foundational philosophy of the program. And navigating this bureaucracy while dealing with addiction is overwhelming, which is why there is a dedicated 247 hotline, 0800-770-885.
So that people can just call that number.
Yeah, it provides anonymous, step-by-step guidance on how to access these exact subsidies, find a local designated clinic, and begin the voluntary rehab process without fear of immediate arrest.
It is a functional lifeline.
Oh.
Well, we've unraveled a massive interconnected crisis today. We traced the evolutionary leap from the HIV needle epidemic to digital vape sales.
We covered a lot.
We dissected the terrifying mechanism of how etomidate paralyzes your nervous system and crashes your adrenal glands. We explored the 16-month bureaucratic blind spots allowing chemicals like MMMP to flow freely. And finally, we laid out the real subsidized medical pathways to recovery.
It's a complex ecosystem, but, dismantling the danger begins with understanding exactly how the machinery operates.
Absolutely. And as we wrap up, I want to leave you with a final thought to mull over. We've seen how effortlessly syndicates can pivot, turning a hospital anesthetic into a weaponized street drug overnight. As artificial intelligence accelerates chemical synthesis technology, allowing cartels to invent entirely new molecular structures in a matter of days, are our global legal systems prepared for a future where a microscopic chemical tweak could turn a completely legal, everyday household item into an untraceable, lethal substance before the ink on the last law is even dry? Thanks for tuning into this episode. If you enjoyed our content, don't forget to like, subscribe, share, and turn on the notification bell. See you guys.